This is Next Gen Web, and we are joined today by Dr. Alexander Vo, Executive Director of the AT&T Center for Telehealth Research and Policy at the University of Texas Galveston. Dr. Vo is here speaking on a panel at the Brookings Institute where they are releasing a study on telemedicine and disaster response and recovery. The report is going to be released in a journal titled Telemedicine and eHealth. Thanks for joining us today, Dr. Vo.
Thank you for the opportunity.
Can you briefly discuss the context of the report and its main findings?
Sure. It's essentially a synopsis of the experience that the University of Texas Medical Branch, or UTMB, went through after the wake of Hurricane Ike. It was Hurricane Ike, as most people know, is the third most destructive hurricane to ever hit the continental United States. It pretty much devastated the entire city of Galveston and surrounding communities of Houston, and it literally shut down the university, which is the oldest medical school and health sciences center in the state of Texas, for several months. But during this time, a little thing happened and that we're very proud of, is that our telemedicine program survived and responded and recovered fairly quickly. Within 48 hours of the storm, we were back in business, providing health care using telemedicine to some of our patients. And within 2 weeks, our activities were back to near normal activities. And those are due to several factors. One is the foresight to pre-plan for disaster scenarios that include building in redundancy broadband networks throughout our system. So we have data backup located in about 108 miles away, as well as the use of wireless technologies to reach out and provide routine, non-emergent medical care to some of our displaced telemedicine patients, as well as displaced providers. So a combination of pre-planning, redundancy, fault-tolerant network, as well as the use of mobile technology has really helped us, did really help us survive the storm intact.
Great. Now, you touched on it a little bit, but can you, go in a little bit deeper on the impact that broadband has had on the delivery of telemedicine, especially when it comes to disaster relief and response?
Sure. So those are two parts. The first is broadband as impact on telemedicine. And for our particular program, that's the backbone of our program. The backbone consisting of broadband private networks that actually has large bandwidth so that we can provide live streaming video, real-time, high definition, as well as enough bandwidth to carry all the other types of medical data electronically to service our EMR. So it's been an invaluable component of our telemedicine program. With regard to disaster response, particularly in some of our correctional setting, it was vital because we had to reconfigure the network to provide telemedicine not only to correctional patients but also to patients of our corporate programs, employee health programs, community health centers that were displaced. So we were able to reconfigure some of the broadband aspects, if you can say, in order to provide those type of services. One of the biggest lessons that we learned, though, even though we had all of this pre-planning, there were some problems that still existed, and that is the scope of the storm was so large that it actually impacted our secondary recovery hub, which is 108 miles away in Huntsville, Texas. So what we're doing now is we're expanding our bandwidth highway even further, so that, and then having multiple recovery hubs. And so those are some of the things we're incorporating broadband into our system.
Great. And can you tell our viewers on where they can find out more about the study?
Sure. It's available on our website at attcenter.utmb.edu, and it will be published in Telemedicine and eHealth in upcoming issues this summer.
Great. Thanks for joining us today, Dr. Vo.
Thank you very much.